Good morning, everybody. I'm Paul Lisnick. Coming up on WGN-TV Political Report.
The vaccine is the best weapon against the variants, and it's the fastest ticket back to normal life.
Tomorrow marks a new day in the fight against COVID-19 as cases rise rapidly across the state. Officials race to get vaccines to all adults over 16. Plus, the economic fallout of the last 13 months is hitting Illinois families hard. We're going to tell you about one plan to help struggling parents get past this pandemic. And later, the fight over an elected school board in Chicago, how a battle of political power is shaping up between top Democrats. But we begin this morning right here in Illinois. The state is set to open COVID-19 vaccine eligibility to all adults over the age of 16 tomorrow morning. Public health officials say they're in a race to vaccinate as many Illinoisans as possible amidst another potential surge. The state hit 2 milestones at the end of last week: a new record high of vaccinations and more than 4,000 new coronavirus cases. That's the highest number of new cases since the end of January. Governor Pritzker, other local officials have warned if the trend continues, the city and state could re-enter a previous phase of mitigations. Now, Dr. Ronald Hirschau is the Director of Epidemiology and Biostatistics at the University of Illinois Chicago School of Public Health. He joins us this morning. Doctor, thanks for joining me. I appreciate your time.
I'm glad to be here. Thanks for having me.
So statewide, as you've heard me say, Illinois is seeing numbers we haven't even seen since January. Public health officials warning we could go back to stricter mitigations if this surge continues. You're the doctor. Fill us in. Looking at the data, how concerned should we be?
Well, I think we should be concerned. I think we're at an interesting point in this outbreak in Chicago and in the United States, for that matter, where we have enjoyed fairly recently major declines in case occurrence from those terrible days of December and January when we hit a daily case count as high as 300,000 cases across the country. And more recently, we've seen marked decreases. But the disconcerting thing was that we never quite got down to a very comfortable level of case occurrence. We hovered around the 50 to 60,000 range as a country, and the same can be said for Chicago and the state of Illinois. We followed that pattern of enjoying that decrease, but then noting that we tended to plateau more recently at the end of March. And now we're in this phase where we are seeing an increase in cases, which is always worrisome. We reached a low point with our case positivity rate, which is one of the key metrics we follow, of about 2.8%, right at the tail end of that nice decline we had. Now we're back up to 5.2%. Wow. And whenever you're above 5%, you begin to be concerned, because that's the threshold level, the 5% level, that the WHO has indicated is a marker for when a society might be able to reopen. So we're skirting right along that key threshold level of 5%.
So given that, I want to ask you kind of a socio-psychological type implication here. There's such a push now for everybody to get vaccinated, and we're moving those numbers up. We're getting more vaccine. Illinois opening eligibility up, as I said, to lots of folks. Chicago going to follow in just a week. So my question to you is this, just from your perspective: is it too late to implement strict mitigations? That is to say, is the way the public attitude has sort of grown, is this sense of hope making it a little more difficult to then go back to restrictions?
Well, I hope not. I strongly hope not, because right along at this phase of our vaccination campaign, both in Chicago, Illinois, and in the country, we're still at the point where people, even if they're vaccinated, are advised to obey the distancing rules, to wear masks and so forth. And with these variants on the rise, particularly the UK variant or the B.1.1.7 variant on the rise, I think people are even suggesting that double masking might be a good idea for the immediate future. as that variant becomes ascendant. That variant is estimated to be about 30 to 60% more transmissible, and it is more virulent than the strains that preceded it. So there are a lot of strong incentives not to abandon those earlier non-vaccine interventions that have been employed to control COVID.
And let me just take that to a next step with you, because coming off of what you've said, we are hearing variants. I'm hearing the phrase double variants now that we might be facing, perhaps around the country. It'll make their way to this state, and even some states reporting people contracting COVID after vaccination. How comfortable, how certain can we be that with our vaccinations we are protected moving forward, and that with mass social distancing we remain protected?
Well, the good news is that we have wonderful vaccines. We have 3 now, the Moderna, the Pfizer, and the Johnson & Johnson vaccine. And all 3 of those vaccines have good activity against the strain that seems to be ascendant right now, that UK or B.1.1.7 strain, which by the end of April may be the majority strain throughout the United States. So the good news is our vaccines work against it very well, protect against it very well. And that, of course, is good news. There may be some minor decreases in protection from those variant strains, but the impression I'd strongly like to leave the viewers with is that those vaccines are strongly protected even against those variant strains, which creates a great incentive to go out and get vaccinated.
Yeah.
We all feel like we're in a rush against those variants, and the surest weapon that we have against those various strains is our current vaccines.
And just about a minute left, Doctor. So I know you've done a lot of work personally in the HIV area and others. So do you have a sense that this virus is going to be comparable, similar to an HIV, in that it will become chronic? We may have to get yearly boosters for this shot. In some ways, is this something we're just going to have to find a way to live with, or is there some other light at the end of the tunnel?
Yeah, it's always hard to exactly or precisely predict the future. But I would say that, yes, it's likely that this virus will stay with us in some form over the ensuing time periods that we're going to live through. I think it is likely that there will be the necessity for booster vaccine doses. Many of those may be directed against specific circulating variant strains like the B.1.1.7. We'll have to watch the strains and watch the epidemiology to make those decisions. But yes, I think we will enter into a period with this virus when hopefully we've attained herd immunity against it, where we may have seasonal outbreaks or periodic outbreaks in different jurisdictions,
right.
And we'll have to stay tuned to prevention recommendations that may well include booster dosing.
And that we will do so. Thank you. Dr. Ron Hirschhauer, thank you so much from UIC. Appreciate your time this morning, shedding up some light, making us smarter. Thank you.
Thank you.
All right.
It's my pleasure.